Hi everyone, thank you very much for attending this session. I'll be talking about the cardiological part of the pediatric CLP. This is my outline. In the previous presentation, we learned many things regarding CLP. I just want to highlight a few points. In order to make our psychiatric interventions efficient compared to the other branches, we need more time. However, the studies show that the patients referred to the psychiatry has gained in a short time. Within a short referral time, there is a correlation between short hospital stay. Physical diseases may be the preliminary risk factors for this spiritual or psychological health for the rest of life, or vice versa. A patient with psychological disorder, the symptoms may make worse the physical symptoms. For example, when a person has cardiovascular insufficiency, their psychology may get worse. And during the childhood, generally mental disorders and physical diseases emerge simultaneously. This is a study conducted on children having mental disorders and physical diseases. A correlation was shown with them, and also the timeline of the same study was conducted later on. And in terms of time course regarding the physical diseases, they showed that cardiovascular diseases may cause anxiety disorders, and epilepsy may cause eating disorders, and such correlations were found. And when we are looking at the diseases, congenital cardiovascular diseases may be seen in 1 out of 100 live births. And the diagnosis is made through imaging techniques and examination, and there are many treatments for this. And only children aged 12 to 17 who had congenital cardiovascular disease, the known psychological disorders, was found to be 32.7%, and most of the time they had anxiety disorder, depression, and loss of concentration. And comorbidity was the psychiatric disorders with the people who had congenital heart cardiovascular diseases. And some adverse neurodevelopment disorders can be seen, which are multiple, interrelated, or cumulative, and these risk factors may be seen over the life. In congenital heart disease, neurodevelopmental delay or disorder prevalence is high, and in the studies, the bonds between the psychological and neurodevelopment results are clearly shown. When we look at the infants, the babies are more sensitive towards the stimuli if they have congenital cardiovascular diseases, and autonomic and motor organization is challenging for them. It's possible for the delayed diagnosed congenital heart diseases or some early nutrition deficiency is correlated with the growth retardation. During the early childhood, there are some additional challenges and frequent separation from their parents, acute problems, exacerbation of the disease, or ruining the daily life routine are among their challenges. And a study was conducted on adolescents with detransposition, and for the adolescents, the executive functions and social cognitive fields was found to be correlated with the psychological health. And these children also show the social retardation, and they are more prone to internalizing these problems. The children with congenital heart diseases by birth, they are more prone to the psychiatric disorders. Again, specifically, single vertical congenital heart diseases among the children and adolescents was found to be higher diagnosed for the anxiety disorder lifelong, and lifelong COPD was also seen 6 times much compared to the healthy children. In terms of congenital cardiovascular disease, these adolescents have are more affected by challenges such as academic challenges regarding their body appearance, if they had an operation, or physical restrictions. That many factors affect them. Again, among the adolescents, some depressive symptoms are seen, and this is related to lower life quality. And despite all this, congenital cardiovascular patients, and as a tiny portion of them are referred to psychiatry, and again, a few receive support and treatment. Arrhythmia and rhythm disorders. The frequency of arrhythmia and any symptoms depending on these. This may also cause some negative effects on psychology of patients because arrhythmia is indicated, is seen with tachycardia or nausea or cold chilling, and this causes anxiety among children. And in another study conducted on adults, the anxiety levels of the people diagnosed with DVT was found to be higher. And on the other hand, on the other side, in some of the studies, psychosocial functions and life quality was quite similar for the children with arrhythmia compared to the healthy children. And ventricular arrhythmia is an important reason for the complications for psychological health, and mitral valve prolapses is also an important cause for the high anxiety levels. It overlaps with the physical symptoms of anxiety. Therefore, many studies were conducted in this field. In MVP group, compared to the healthy controls, it's higher, and anxiety score was always higher. And when we look at the updated study on mitral valve prolapse and disorder, panic disorder, among the general population compared to the controls, the patients with MPV were found to be suffering from panic disorder. In MPV, tachycardia and arrhythmia accompanies with these negative effects, and on the contrary, anxiety disorders cause some stress disorders, and it actually ruins the synchronization of the ventricular valve of the heart. Therefore, it may also cause MVP, and this is such a hypothesis claimed by some of the authors. And some authors says that both disorders in the autonomous neural system are interrelated. However, these are still hypotheses, not validated. When we see these hypotheses, anxiety disorders and mitral valve prolapse studies were conducted. And then the following studies showed that the children with anxiety and healthy children were compared, and MPV screening was done, and only one in the control group was diagnosed with MPV. As an outcome of this study, it was shown that there was no correlation between MPV and anxiety disorder. And mitral valve prolapse children, the disorder of anxiety was seen frequently compared to the control group. In MPV group, anxiety disorder was seen at higher level in terms of symptoms and its severity. There was a significant difference between the two groups. When the study is over, we will provide more data to literature. For the cardiomyopathies, dilated cardiomyopathy children were compared to the healthy children. The children with dilated cardiomyopathy internalization problem was higher, and they were reporting their physical problems more. For hypertrophic cardiomyopathy, their level of life quality was lower. For the congestive heart failure, although it's not frequently seen during the childhood, it has serious results. Therefore, it's an important area to be handled. In the treatment, there are some factors causing this heart failure, and also pharmacologic or heart transplantation are the methods referred. There is a study conducted on adults. Major depressive disorder is indicated to be an independent determinant for the heart failure, but independent on the severity of the heart failure, anxiety levels are shown to be related to the mortality rates. There is not a similar study conducted on children in literature, but when we compare the children with heart failure to the healthy ones, this literature shows us great evidence. And also, cardiac treatments have an impact on the psychological mode. For example, the patients who undergo radiofrequency treatment, their anxiety levels and life quality were not different. But there are a few studies on the adolescents with ICD. Before and after the patients were implanted ICD, the depression and anxiety symptoms or their psychosocial functions were not different. However, when they need defibrillator and exposed to shock, depression and anxiety was found to be risky for that group. Ventricular support device is actually especially necessary for circulation support, and these are external devices, and it's necessary for the it's vital for these patients. And in pediatrics population, these devices are being used at higher levels recently, but this is quite a technical device. They are used at hospitals. You need to follow up the instructions, and they need to ensure the security of the machine and also prevent any infections. Therefore, in a study conducted with the adults with VDC, the depression and compliance disorder was found to be symptoms among these adults. In Turkey, 8 children were participated in a study aged from 1 to 16, and psychological support was provided for these children because 2 patients suffered from depression, one was suffering from anxiety, and for heart transplantation, neurodevelopment delays and weak adaptation to the treatment can be seen after the transplantation, especially the emotional compliance challenge was found not to be related with the transplantation. However, the challenges and difficulties they lived in adaptation to the normal life was normal among those children who had heart transplantation, and the depression and anxiety disorders were related to the short hospital stay, and also anxiety was also related to readmission levels. There was another study with a greater sample. The heart transplanted patients were examined, and 14% of them were found to be present with psychiatric disorder symptoms, and also antidepressants were administered for those children. Until now, regarding the cardiovascular diseases and psychiatric disorders were examined. Now, I want to touch upon the relation between these two. There are many risk factors affecting the relation between cardiovascular diseases and these psychiatric disorders. For each diagnosis, there is a risk factor and they change. For example, in autism spectrum disorder, obesity, less physical activity. However, the children with DHAP, diabetes, cigarette smoking, and alcohol use accompany the symptoms, which clinically means that in our daily practice we see these diagnoses. However, for general population, these diseases themselves affect the cardiovascular risk. Therefore, we need to evaluate the patients as a whole from a holistic point of view. And finally, in cardiologic stations, use of psychotropes and antidepressants. Tricyclic antidepressants have some pro-arrhythmic effects and they are not recommended. However, in the depression cases resistant to other treatments, SSRIs can be used, but with care, especially sertraline and citalopram are recommended. However, for the patients used on anticoagulants, SSRIs exacerbate the platelet aggregation and distort the activation. Therefore, these patients must be followed up diligently. For the patients who are on warfarin, SSRIs are increasing the bleeding risk compared to the other antidepressants. Therefore, we need to use them cautiously. Venlafaxine and duloxetine, there are no studies regarding these two medications. And there are many effects of antipsychotics on the cardiovascular system. They have pre-arrhythmic side effects, and also alpha-1 antagonist features are related with these effects. Alpha-1 adrenergic receptor affinity, chlorpromazine, clozapine, olanzapine, and sertraline are has high affinity, while quetiapine and risperidone have middle, while aripiprazole has no affinity with this. And again, when antipsychotics also block the potassium channels in the myocyte membrane of heart, QTC periods are not being impacted by the aripiprazole. The other medications that we use, stimulants and amatocyclines, we know that they have effect on the blood pressure and also heart rate. However, QTC elongations or serious cardiovascular problems are not expected. According to a study conducted by Winterstein et al., methylphenidate is indicated to increase the heart rate around 5 pulses. Again, A2 adrenergic receptor blocker, gonzapine and clozapine cause a lower heart rate and also blood pressure. So it must be used carefully with the ones who have cardiovascular disease history in their family. Pediatric cardiologic situations provide very valuable data for us, especially while we are working at the hospitals. In order to optimize the physical, psychological, and social results, we need a multidisciplinary cooperation. With that, thank you very much for your attention.